What's going on? Happy Hump Day. This is episode 6 of Over the Hump, where every Wednesday I'm going to be coming on to give you guys more information about a specific health or physical therapy related topic, hopefully to help get you over the hump with whatever your current problem is. This week we're going to be talking about ankle pain. Unfortunately, a category I know far too much about. I've had my ankle completely reconstructed, and then I've also had 2 follow-up surgeries, so we'll talk a little bit more about that later on. But it's allowed me to really hone in on which exercises are most effective for ankle pain. And I want to talk a little bit about different types of ankle pain that you may be experiencing first to help narrow down which is going to be most effective. When you're talking about joint pain, the most important part of the process is honestly figuring out, do you have a mobility deficit or do you have a stability deficit? And sometimes we often have both. In the case of like arthritis or in case of like post-trauma, a lot of times you're going to have both. Still need to figure out maybe which one is a priority or which one is the most limiting factor. Since we definitely don't have time to go over both of those today, we're going to start with mobility and specifically dorsiflexion mobility in the ankle, which I've found to be by far the most helpful range of motion to improve in most patients. First off, I want to break down the ankle joint into 2 different categories. The first one is the talocrural joint. This is the joint most people really think of when you think of the ankle joint. It provides most of our dorsiflexion, which is when we bring the foot towards the tibia, and plantar flexion when we bring the foot away from the tibia or the lower leg. So it's predominantly responsible for those 2 motions. However, it's actually also responsible for most of our pronation and supination, which is something you won't find on Google. But because of the laxity in the ligaments of the deltoid ligament on the inside and then some of the outer ligaments like your ATFL, which is the one that's most commonly sprained, or your CFL, those ligaments have a fair amount of laxity that actually allow for quite a bit of pronation, supination, inversion, eversion. That's the main joint. The one below that is the subtalar joint. So sub meaning below, talar meaning talus. Below the talus, we have another joint called the subtalar joint, which is the interaction of the talus on the calcaneus. That is like technically responsible for most of your inversion and eversion. Inversion means like if the foot's facing you, inversion is like you're pointing the arch of your foot towards your other foot. Eversion is like you're pointing the arch of your foot away from your other foot. I don't know how helpful that is, but anyway, we need all the motions. We need all the motions, but those are the 2 main junctions of the ankle. The one I'm going to be talking about most today is the talocrural joint, because that is where 90+% of people's ankles problems can be solved by just addressing issues at that joint. Because it's responsible for so much of the movement of that joint, you can even make up for lost subtalar motion with extra talocrural motion as long as it's well controlled by the motor control system. So I want to talk about 1, how to mobilize that joint, and then 2, how to get good motor control or stability at that joint throughout the range of motion. All right, so in PT school, we had an acronym called MESIF. MESIF is how you are supposed to approach any given injury that would fit the criteria, and it stands for mobilization, stretching, exercise, and then something functional. So MESEF, MESIF. I had to think about that for a second. Anyway, so the idea is you don't want to stretch soft tissue before you have mobilized the joint, or at least cleared the joint. So let's say the calf comes back. I was gonna get a little band, but like the calf comes around behind here, right? So if I'm going through dorsiflexion, yeah, it stretches the calf, okay? That's why normally when you go and do like a calf stretch, you're also doing ankle dorsiflexion. The most important thing to think about when you are doing a calf stretch is, do I feel this in the front of my ankle or in the back of the ankle, or like where the calf is? Because if you're doing a calf stretch and you feel it in the front of your ankle, stop doing that. Stop doing a calf stretch until you have cleared the joint, because the joint is the most limiting link in that chain. It's not that your calf may not also be tight, but if you're doing a calf stretch and you're feeling it in the front of your ankle, the calf is not the limiting factor. The talocrural joint is the limiting factor. So we need to mobilize that joint first. So if we're going to talk about mobilizing a joint, I want to quickly talk about joint mechanics. And I'm not trying to get too crazy here, but I want you guys to recognize that when we go from a plantar flexion position to a dorsiflex position, that the talocrural joint, as it moves, the talus is rolling forward into the joint, and it needs to be able to glide backward into the joint. So the posterior capsule of the joint is usually what's limited if dorsiflexion is limited, meaning the ankle, the talus has been pushed too far forward into the relative position as it is adjacent to the tibia. So the talus is too far out in front of the tibia. It's not able to glide backward. So as it's rolling forward, it's getting stuck, kind of like this guy's is. It needs to be able to roll forward and glide backward so that it can maintain the joint position as we move. So all that is to say, what you need to do to mobilize the joint is a posterior glide of the talus. There is also a way to do a relative anterior glide of the tibia upon a fixed talus while going through dorsiflexion. And I might look at that in a minute, depending on how creative I want to get with this video. But you need to do a posterior talocrural glide. That is going to be the most effective way to free up the anterior joint space and then allow you to actually go through a calf stretch that will help you to improve your range of motion. All right, guys, I hope you can see this. This is where you get your money's worth out of this particular video. You're like, wait a minute, I thought this shit was free. So what we're gonna do is you get a crappy old tennis shoe that meets you underneath the medial and lateral malleolus. Those are those two big sticky outy bones at the end of the tibia. We gotta be under those. So that part was correct about the band mobilization. What we are trying to do is give everything below those bones a posterior glide, which is what is required for the foot to move upward towards the leg. Remember, when we go from here to here, the talus rolls forward and glides posteriorly. That's how that happens. So what I want to do is snag on the inside of the back of the shoe. And this is why you use a crappy shoe, because it's going to stretch your shoe out. But it's worth it. From there, I stabilize at the tibia. So I've got this leg crossed up over my other knee. I'm stabilizing and giving an anterior force at the tibia. From here, I'm going to apply equal and opposite pressure in those directions. I'm pulling this part back, I'm pushing this part forward at the same rate. So nothing really moves structurally at the leg, but I'm getting a lot of glide at my ankle. This is by far the most comfortable and most effective self-posterior talocrural glide I have ever found. You're welcome. So again, just hold here, gently pull back, and I try to keep the foot in just slight plantar flexion, which is technically the open packed position for the joint. Typically, how do I do this? I do 10 to 15, and my joint is just clunking all over the place right now, 10 to 15 gentle oscillations, pulling this into a posterior glide, and then I maintain a posterior glide and go through 10 to 15 repetitions of dorsiflexion and plantar flexion while doing a maintained posterior glide. That's a mobilization with movement. And then I end on a few more posterior glides. And then I will typically follow that up with the other exercises that I'm going to show you. But the acronym for this that we use in PT school is MESF, M-E-S-F, which is mobilize, stretch, exercise, and then do something functional. This is a joint mobilization. We need to do that first, because if we go to stretch any of the soft tissue structures and we haven't mobilized the joint is always going to be the limiting factor. You need to clear out joint restrictions before you stretch in order to make the stretching or other mobilization exercises effective. Okay, so to give you guys a better view here, we're gonna zoom in, and I just wanted to show that you're pushing directly forward with the upper arm and pulling directly backward with the lower arm. No twisting or rotation, and make sure you are going slow and adjusting if you have any pain. So that was more of an accessory glide because we're not really changing the amount of dorsiflexion or plantar flexion that we're taking the ankle in. There are also mobilizations with movement where the foot is fixed and there's like, a band coming around behind it pulling that way, and the person's going through dorsiflexion. I don't know if that makes any sense. Those are fine. I don't really think those do what we think they do. You're not getting an actual glide of the joint posteriorly with that elastic band. That's just not happening. You're probably getting a neurophysiological effect, and it's desensitizing the tissue. That seems plausible. You might be moving some soft tissue around, but you're not really gliding the joint. I did post a video last week where you basically do the opposite with a big belt. that can't bend, and you're giving an anterior glide to the tibia relatively to the talus, which is a posterior glide to the talus basically, in a fixed position where you can apply a lot of load. And I think that one I've definitely seen good results with clinically, so I would try that. I'll post a link for that somewhere. I have no idea how to do that, so I'm just kidding. But you can go back. We don't post that many videos. It shouldn't be too hard to find. It was last week, I think. But that would be helpful for sure if you're wanting a mobilization with movement technique. If you're still unable to feel a calf stretch in the back, like in the calf or soleus, and you're still feeling it in the front of the ankle, I would work on the posterior glide that I showed you. Then I would do that anterior tibial glide, which is a mobilization with movement. Then I would progress on to the calf stretching. That's a great sequencing. If you still only feel it in the front of your ankle, you gotta just come in to see somebody. I don't know what to tell you. That's all you should do. And we can work with you on improving the glide of the talus. But honestly, it is sometimes it's difficult with ankles to apply enough force. If you think about the amount of force in your foot and ankle complex when you're walking around or jumping or running all day, and then you're like just trying to like move it all with a little elastic band, like shit's not gonna happen. So a lot of times you need to come into the clinic, and we need to really kind of like, you know, put some manual labor into it and see if we can get it moving a little better. So that's just kind of the reality. Now let's take a quick look at how to stretch the gastroc and soleus. If we have the knee totally straight as shown here, we are going to be stretching the gastroc muscle. This crosses the knee, so we do need to have the knee locked out in order to get it a good stretch. As we bend the knee inward as shown here, we are now biasing that deep layer called the soleus. Here, this is where you'll feel typically more of a stretch down lower towards the Achilles. It's important to go back and forth through these different positions of knee bend to make sure you know which layer is more restricted and which one needs to be stretched. One thing people usually don't think about is the position of their ankle during a calf stretch. Because the ankle wants to fall into pronation, you really have to work hard to supinate the ankle or use a block like I'll show you in a second to help keep the ankle in a supinated position. Here I am starting in pronated position. I roll up into a supinated position to hold that to show you guys. You don't want to let the ankle fall down into that pronated position. So really try to hold it up to make sure that we're not losing stretch on the calf because of the change in foot and ankle position. So from this back position, you can see I'm starting very pronated, and now I'm trying to supinate up a little bit. Another good option to help with this is to just use a slant board or even a towel on the inside of your foot. This slant is helping my ankle to maintain a more supinated position so that it is not falling inward to the inside, which is pronation. If we fall into pronation, we really lose a lot of the stretch because more of that motion is getting soaked up at the foot and ankle complex. You can see here the angle outside of my heel, and when I prop it back up, that angle is much more vertical. This allows more of the stretch force to be transferred up into the gastroc or soleus. Another great way to help get more stretch out of these positions is to elevate the forefoot. This increases the stretch on the calf or soleus pretty significantly. Again, it depends on whether your knee is straight or bent as to which one you're stretching. With the knee bent, you're going to hit more of those deeper soleus fibers, and with the knee straight, you're going to hit more of the superficial gastroc, but adding an elevated surface can improve your stretch dramatically. So this little contraption is supposed to represent a calf muscle. And there's a lot of different names. I mean, if we want to talk about the complex, I'm really talking about both gastrocs and the soleus, which would be your triceps surae. But the muscles on the back of your lower leg that you feel when you go into like a calf stretch, we are now able to stretch those muscles better because we have more freedom of range of motion at the ankle joint. So the question is, what position do you need to be in to best stretch these muscles? And it depends on which layer we're stretching. So if this blue band were to represent the soleus, which is the deeper layer or the layer closest to the tibia, then there would be another layer out behind this called the gastrocnemius, but those are the ones that you normally think of actually when you think of your calf muscle that have like the two heads on either side of the calf. Those are your gastrocs. Those are like the outer calf muscle. The soleus is a slower twitch type muscle fiber that is more endurance based, and the gastroc is a more explosive type 2 fiber that is more, power based. Okay, so but we need to stretch these in different positions because of where they originate and insert. Well, they both insert about the same spot, but they originate in different spots. The soleus does not cross the knee. So it would attach below the knee on the back of the tibia, the gastroc actually crosses the knee joint and attaches up on the back of the femur. So because of that, we can bias these two different muscles, or the position that we stretch these two different muscles, to figure out which one of them is limiting our range of motion the most. And I'm going to show you how to do that now at a wall.
So the main thing you need to think about when you're going into a calf stretch is your knee position. If the knee is straight, like it is here, I'm stretching the gastrocnemius, the two heads on the backside that do cross the knee. If we bend the knee, because we are slackening the gastroc as they cross the knee, we are now biasing the soleus, and we're getting more of a stretch out of just that deeper muscular layer at the back of the leg.
Such a high percentage of ankle pain patients and low back pain patients and SI joint pain patients get better just by improving ankle dorsiflexion that I wanted the first video to be on that. Because if you can do one thing to improve foot and ankle function, it's typically to improve your dorsiflexion first. That helps with load going to the Achilles. It helps with load going into the plantar fascia. It helps with load going into the anterior ankle being transferred up into the chain through the hip and low back. Helps with all the things. So I would really spend time focusing on that. So thank you for watching this episode of Over the Hump, and we'll be back next Wednesday to cover another topic. Thank you.